It sounds like you like some help with creating music using a digital.
Hypertension, also known as high blood pressure, is a medical condition in which the force of the blood against the artery walls is consistently too high. Over time, this increased pressure can cause damage to blood vessels and lead to serious health problems, such as heart disease, stroke, kidney failure, and more. Definition: hypertension is generally defined as having a blood pressure reading of 130/80 mmHg or higher on multiple occasions. Systolic pressure, the top number, measures the pressure in the arteries when the heart beats. Diastolic pressure, the bottom number, measures the pressure in the arteries between beats. Hypertension, also known as high blood pressure, is a condition in which the force of the blood against your artery walls is consistently too high. Over time, this increased pressure can lead to serious health problems, such as heart disease, stroke, and kidney damage. Normal blood pressure, usually around 120/80 mmHg. Hypertension, typically defined as blood pressure 140/90 mmHg or higher over several readings. It often develops slowly and may go unnoticed for years. It's often called a silent killer because it may not cause symptoms until damage has already occurred.
It sounds like you like some help with creating music using a digital.
Common causes of hypertension. Obesity. It is a medical condition characterized by excessive body fat that may impair health. It is typically measured using the body mass index, BMI, which is calculated by dividing a person's weight in kilograms by the square of their height in meters, kg/m superscript 2. Generally, BMI of 25 to 29.9 is considered overweight and a BMI of 30 or higher is considered obese. High salt intake refers to consuming more sodium, salt, than the recommended daily amount. Salt is primarily made up of sodium chloride, and sodium is essential for bodily functions like nerve transmission and fluid balance. However, too much sodium can be harmful to health. Lack of physical activity. It is lack of physical activity, also known as physical inactivity, refers to not engaging in sufficient movement or exercise to maintain health. It typically means not meeting the recommended guidelines for physical activity. Chronic stress. It refers to a consistent sense of feeling pressured and overwhelmed over a long period of time. Unlike acute stress, which is short-term and often resolved quickly, chronic stress can wear down the body and mind over time, leading to serious health issues. Smoking. Smoking refers to the act of inhaling and exhaling the smoke produced by burning substances, most commonly tobacco. The most common form of smoking is cigarette smoking, but it can also involve cigars, pipes, and other forms of tobacco use. When tobacco is burned, it releases nicotine and a variety of harmful chemicals, including tar, carbon monoxide, and carcinogens, which can be harmful to the body. Excessive alcohol. Excessive alcohol consumption refers to drinking alcohol in a manner that poses risks to your health or well-being. It generally involves drinking beyond moderate limits, which can lead to various short-term and long-term consequences. There are two main forms of excessive alcohol consumption. Kidney disease. Kidney disease, also known as renal disease, refers to conditions that affect the kidney's ability to function properly. The kidneys are vital organs that filter waste and excess fluids from the blood, regulate blood pressure, and help maintain a balance of electrolytes. When kidney disease occurs, these functions can be impaired, leading to a buildup of waste, fluid, and toxins in the body. Family history. Family history in hypertension refers to the presence of high blood pressure, hypertension, in close relatives, such as parents, siblings, or other immediate family members. Having a family history of hypertension increases the risk of developing high blood pressure, as genetics can play a significant role in the condition. If one or both parents have hypertension, there is a higher likelihood that their children may also develop the condition, though lifestyle factors like diet, exercise, and stress also influence the development of hypertension.
It sounds like you like some help with creating music using a digital.
Age is one of the most significant risk factors for hypertension, high blood pressure. Here's how they are related. 1. Increased risk with age. Blood vessels stiffen over time, leading to increased resistance in the arteries. This raises blood pressure. Most people develop some degree of hypertension as they age. By age 45, more than 1 in 3 adults have high blood pressure. By age 65, that number rises to over 2 in 3. 2. Types of hypertension by age. Younger adults are more likely to have diastolic hypertension, elevated lower number. Older adults often develop isolated systolic hypertension, where only the top number, systolic, is high. This is particularly associated with cardiovascular risks in the elderly. 3. Consequences. Older adults with uncontrolled hypertension are at higher risk for stroke, heart attack, kidney damage, cognitive decline, including dementia. 4. Prevention and management. Healthy lifestyle habits, diet, exercise, limiting salt/alcohol are critical at any age. Regular blood pressure monitoring becomes increasingly important with age. Medication may be required, especially for people over 60 with sustained systolic BP greater than or equal to 130 to 140 millimeters of mercury.
It sounds like you like some help with creating music using a DJ.
Hypertension management. Lifestyle changes, diet, exercise, reducing stress. Medications, diuretics, ACE inhibitors, beta blockers, etc. Regular monitoring. Would you like a simple diagram explaining how blood pressure works in the body? Protecting against hypertension, high blood pressure, involves a combination of lifestyle changes, dietary choices, and regular health monitoring. Here are key strategies to help prevent or control hypertension. 1. Eat a heart-healthy diet. Follow the DASH diet, dietary approaches to stop hypertension. Rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy. Reduce sodium intake, aim for less than 2,300 milligrams per day, ideally less than 1,500 milligrams. Limit processed foods, high in salt, sugar, and unhealthy fats. 2. Stay physically active. Aim for 150 minutes/week of moderate exercise, e.g., walking, cycling, swimming. Exercise helps lower blood pressure, manage weight, and reduce stress. 3. Maintain a healthy weight. Losing even 5 to 10% of your body weight can significantly lower blood pressure if you're overweight. 4. Limit alcohol and quit smoking. Alcohol, limit to 1 drink/day for women, 2 for men. Smoking raises blood pressure and damages blood vessels. 5. Manage stress. Practice relaxation techniques, meditation, deep breathing, yoga, or hobbies. Chronic stress can raise blood pressure over time. 6. Monitor blood pressure regularly. Use a home monitor or get regular checkups. Early detection helps prevent complications. 7. Follow prescribed medications. If you're at risk or already diagnosed, take medications as directed. Never stop meds without your doctor's guidance.
It sounds like you like some help with creating music using a DJ.